Hello, my name is Dr. Ganavi and I'm working as consultant endocrinologist at Ramaiah Memorial Hospital. Today I'll be talking about insulin. Insulin is a hormone produced by the pancreas. Insulin acts by helping the glucose present in the blood to enter the cells. So whenever the insulin levels go down or whenever there is resistance to the action of insulin, the blood glucose increases and diabetes sets in. So basically there are two different types of diabetes, that is type 1 diabetes where there is absolute insulin deficiency, that is insulin is not produced in the body, and in these patients they usually require insulin 4 times a day. That is 1 shot of a basal insulin, that is the long acting insulin, and 3 shots of short acting or rapid acting insulin. So when insulin is taken 4 times a day in this the type of patients, that is the type 1 diabetic individuals, the blood glucose control is better and the incidence of complications related to diabetes can be decreased to a much greater extent. Coming to type 2 diabetes is a condition where there is insulin resistance. That is, the insulin, though the insulin is sufficiently produced in the body, there is some amount of resistance to the action at the level of the cells. So in such patients, these who can be managed for about 8 to 10 years with tablets, the insulin levels decline over time, and in these patients they will require insulin at least once a day of basal insulin to start with. If at all, if the blood glucose levels are not controlled with once a day, we increase it to twice a day or even thrice a day insulin. However, there are many misconceptions related to insulin. One is it can cause kidney liver dysfunction, and the other is once insulin is started, it has to be continued throughout life. So definitely these misconceptions are false. The benefits which are seen with insulin are much to a greater extent. That is, it can control the blood sugars very rapidly. It's the most efficient and the safest way of controlling the blood glucose. So the insulin which are available these days are very user friendly. They can be taken just 5 minutes before meals, and even the devices which are used to take the insulin, that is the pen devices, are also quite user friendly. So with this, if at all, if the blood glucose is not controlled in a diabetic individual, it is one of the safest modalities of treatment and hence should be considered.